Hello, my name is Maliha Alam, and I'm going to discuss and talk about the plan process improvement through EHR assignment. The objective for this assignment is to identify information needed for designing an EHR to manage a depressed patient based on the genetic information. Identify the information needed on first call to clinic, first visit, between first and second visits in 8 weeks, and eventually at recommended time for subsequent visits. Clearly identify the point in time when you recommend that the patient receive an antidepressant prescription. Describe who will receive the information and how this information will lead to the change in prescribed antidepressant. The assumptions are that the patient has an assigned primary care physician, the patient has health insurance, the patient recognizes that he/she demonstrates signs of depression. The patient is first seen by his or her primary care physician and then is referred to a specialist, which in this case is a psychiatrist. The patient has a pharmacy assigned, and also the patient is suffering from an unidentified form of depression. So this is the first call to the primary care physician, and we'll address it as PCP. The information from the patient is collected, which are listed down below. The patient's first and last name, the patient's date of birth, the reason for the phone call or the visit. The patient's insurance information is also collected, which includes the name of the health insurance company and the patient's number on the insurance card, the patient's phone number and patient's address. And also the patient is asked when he or she is available for the scheduling with the first appointment with the PCP. Then, this is the first visit with the primary care physician. The patient's demographics are collected, personal and family medical history, list of allergies, and any current medications the patient is on. So the patient has to list all this information, which will be stored into the EHR and uploaded. Patient's insurance information is also collected, and sometimes they require a photo ID. The patient's history, medical history, the symptoms and vitals are done during the visit. The patient's level of depression and also any details that will be helpful for the primary care physician to know is also asked during the visit. Then, so again, this is the visit with the primary care physician. So the physician evaluates the patient's condition. The physician checks the level of the depression and how if it's worse or moderate. The physician prescribes an antidepressant medication for the patient after the physician is done reviewing the severity of the depression. The physician schedules the patient to follow up within a week. The prescription that the physician had done has been sent to the pharmacy, and the patient will pick it up from the pharmacy. This is the second visit with the primary care physician, and it's week 2. The physician performs an evaluation on the patient, which will let the physician know about the patient's condition. The physician determines that the patient's symptoms have not improved, and so the physician refers the patient to a psychiatrist. The patient schedules an appointment with the psychiatrist for the following week. First visit to the psychiatrist. These are the information that are collected from the patient in this visit. Patient's demographics, patient's reason for visit, patient's insurance verification, patient's medical history, patient's pharmacy, and the patient's symptoms and level of depression. The psychiatrist recommends that the patient to get the genetic testing done to understand the depression better. The psychiatrist orders the DNA test for the patient. The sample then will be sent to the lab to get tested. In the meantime, the psychiatrist prescribes another antidepressant to the patient. The patient will make a follow-up appointment in 3 to 4 weeks with the psychiatrist again. This is the second visit with the psychiatrist. The psychiatrist examines the patient, but the patient is still showing the symptoms for depression. And so the psychiatrist recommends to continue the antidepressant medication. The psychiatrist further recommends to change the lifestyle routine and also hands out a guide to the patient that lists the lifestyle changes which can improve the symptoms for depression. The patient is scheduled for another appointment again in 4 to 7 weeks. This is the third visit with the psychiatrist. The patient comes to the appointment in week 5. but again, no changes occur to the level of depression. The psychiatrist discusses the genetic testing results with the patient. The patient is prescribed a new antidepressant medication after reviewing the genetic testing results. The patient is then scheduled for another appointment in 4 weeks. All the information in the week's visit are updated in the EHR system accordingly. This is the 4th visit with the psychiatrist. In week 6, the patient sees the psychiatrist again. The patient informs the psychiatrist that his or her condition is improved with the new medication and lifestyle changes guide that was recommended by the psychiatrist. The psychiatrist recommends the patient to continue the medication and the steps that caused the improvement in the depression levels. This treatment was based on the genetic testing. The patient will then be meeting the primary care physician if it's required based on the symptoms, and the patient will make that appointment whenever he or she finds it's required. So this slide basically shows the information exchange between the patient, the primary care physician, psychiatrist, lab, and the pharmacy. The categories on the left in the first column are the name, demographics, patient medical history, symptoms, insurance, prescription, genetic information, genetic tests, genetic results. This table shows what information is exchanged between the multiple actors in this field. So as you can see, between the primary care physician and the psychiatrist, the patient's name, demographics, symptoms, insurance, genetic information, and patient medical history and genetic results are shared. And then the lab also shares the genetic information, the test results, and the genetic testing, and so on. And so does the pharmacy with the insurance, prescription, and the name, demographics. So this is the summary. This process suggests what kind of information is collected and when it is accessed by the many people the patient is connected to through the EHR. This process also suggests how the information is accessed by different people, for example, the physician, the pharmacy, the lab, etc. How the genetic information manages treatment, and the suggested steps can reduce the number of visits to the clinician if the flow of information is correct through the EHR. And this is the end of my presentation. Thank you.